Hi guys, welcome back to another video of your channel. So today's topic is from veterinary pharmacology, that is orthoped pharmacology. So we will be discussing about the Melonex injection. So the Melonex injection is the Meloxicam, which is marketed and produced by Indus Pharmaceuticals. We'll directly go to the video. So if you haven't subscribed this channel, feel free to subscribe and hit the bell icon for more updates. So this is actually the structure of Meloxicam. So the content of Melonex is Meloxicam. Meloxicam is a COX-2 inhibitor. So the mechanism of action, meloxicam inhibits prostaglandin synthetase enzyme. So what happens? This will lead to blockage of cyclooxygenase 1 and cyclooxygenase 2, which is known as COX-1 and COX-2 enzyme. So whenever this COX-1 and COX-2 is inhibited, this inhibition leads to decreased synthesis of prostaglandins. So prostaglandins are the main agents or mediators, cellular mediators or biomediators, which will result in pain sensitization and normal inflammatory reaction and normal inflammatory symptoms. So whenever we are giving prostaglandin synthesis inhibitors, that is meloxicam, what happens? Inflammation subsides. Painful inflammation will not be happening and the pain will be decreased. So as prostaglandins sensitize the neuronal pain receptors, inhibition of their synthesis will lead to analgesic and anti-inflammatory effects. So they belongs to the category NSAIDs, that is non-steroidal anti-inflammatory drug with mild analgesic and more anti-inflammatory power. So this is the mechanism of action of NSAIDs. So from cell membrane phospholipids, phospholipase A2, this is actually whenever any trauma or any wound is there, phospholipase A2 will be activated and they will be producing arachidonic acid, and arachidonic acid will be acted upon by COX-1 and COX-2, and thus they produce prostaglandin G2, prostaglandin H2, and thus they produce many prostacyclin, prostaglandins and all. So the NSAIDs or our meloxicam will be blocking at this stage. Arachidonic acid to prostaglandin G2 will be blocked. So what happens? The synthesis of prostaglandin does not occur. So inflammatory reactions will be very less. So where all can we use this meloxicam? So in case of osteoarthritis, we use to indicate the relieve the signs of symptoms of osteoarthritis, rheumatoid arthritis, moderate to severe pain in case of joint ill, which is a very common infectious disease or infectious condition in neonates, and postoperative or preoperative medication in case of surgery, and also in case of wounds and all, we can go for this meloxicam administration. So the composition of meloxicam or the Melonex is actually meloxicam with benzyl alcohol. So the dosage and administration route, we can go for intramuscular or intravenous or subcutaneous route. And in case of dosage, the cats we have got 0.2 mg per kg body weight, and in case of dogs 0.5 mg per kg body weight. Large ruminants it's 0.5. Dogs and large ruminants, they have got nearly the same dose. Whereas in case of small ruminants, you should have to focus on this thing, that is sheep and goat. And also in case of pigs, we will definitely go for 1 mg per kg body weight. So side effects. So due to the blockage of synthesis of prostaglandins, they have got some side effects. Normally, prostaglandins should have been synthesized and they should have done some purposes in the body. So whenever we are blocking the production of prostaglandins, there will be some side effects. That is nausea, abdominal pain, and gastric ulcer. Gastric ulcers are very common side effects of this NSAIDs. Constipation will be there, cough, dizziness, headache, loss of appetite. So the main points, it's actually contraindicated in late gestation because whenever the animal is going to the late gestation period, if we are controlling the prostaglandin synthesis, this can lead to many problems with the gestation and the embryo. So contraindicated in case of dehydrated and hypotensive animals. So that dehydrated animals should have normal prostaglandin synthesis. Whenever we are suppressing the prostaglandin synthesis in case of dehydrated or debilitated or hypotensive animals, this will lead to shock, hypovolemic shock, and that can lead to even death. So the presentation of Melonex is actually each ml will contain 5 milligram of meloxicam and benzyl alcohol 2% weight by volume. So storage below 25 degrees Celsius and protect from sunlight. So marketed by Indus Pharmaceuticals. So this is actually the drug. You can see the presentation is 100 ml, and you can go for IM, IV, and subcutaneous use. Meloxicam is the content. Indian Pharmacopoeia, 5 mg per ml. So in 1 ml there will be 5 mg. So this will be 5 mg into 100. This is 500 mg per 100 ml. 5 mg per ml presentation. So marketed by Indus Pharmaceuticals, which is based on Gujarat state. Thank you.